Hi, in this video I'll be talking about thick dark skin which is seen at the side and back of the neck, which is known as Acanthosis nigricans. I'll be discussing what is Acanthosis nigricans, why do you develop it, what is the association and significance if you have Acanthosis nigricans, things to avoid, and finally the treatment. Myself Dr. Kiran KC, I am a dermatologist, hair transplantation surgeon working in Haldwani, Uttarakhand. Let's start. What is Acanthosis nigricans? Acanthosis nigricans is a thick, dark skin with velvety texture, usually seen at the side and back of the neck. The other areas which are involved are underarm, that is the axilla, groin area, okay, and face. In severe cases, you can also see Acanthosis nigricans in front of the elbow, back of the knee, and below the breast area. Okay, usually, okay, it's a fairly common disease. At least 20% of the people are affected, that is 1 in 5 persons are affected. Skin tags are usually occurs along with Acanthosis nigricans. Already I have made a full video on skin tags, which is also known in Hindi as masse. You can, to know more about it, you can watch those videos. Okay, both males and females are equally affected in case of Acanthosis nigricans. Acanthosis nigricans can develop at any age, but usually develops in adulthood around the age of 40 years. Now let's discuss why do you develop Acanthosis nigricans. The main reason to develop Acanthosis nigricans is insulin resistance. That is, that receptors, okay, the insulin receptors in the body don't respond to it. Don't respond to insulin. So there is increased production. There is lot of production of insulin and insulin like growth factors. This insulin and insulin like growth factor increases the production of cells in the skin. That is, there is increased proliferation of keratinocyte and fibroblast in the skin, which result in a thick dark skin. Okay, so this is the reason. The main reason is insulin resistance. Okay, so now let's discuss what are the association, what is the significance if you have Acanthosis nigricans. Since I've already mentioned the main reason is insulin resistance, so the most common association is type 2 diabetes mellitus, that is insulin resistant diabetes mellitus. So usually if you have Acanthosis nigricans, okay, you can develop, okay, diabetes, okay, in a future age. There are more chances of developing diabetes in a future age. Also, you might have already developed diabetes. Okay, the second association is obesity. The third is metabolic syndrome. Metabolic syndrome is a cluster of conditions which are high glucose level, okay, high blood pressure, okay, abdominal fat, okay, and high cholesterol, particularly your triglycerides are high, whereas low HDL, which is the good cholesterol, which is low. So all this cluster of conditions, okay, leads to increased risk of heart condition, heart disease, okay, that is cardiovascular disease. So metabolic syndrome is this cluster of conditions, okay, which results in higher risk of you developing heart disease or cardiovascular disease. The other associations are polycystic ovarian disease, okay, then hypothyroidism and acromegaly. So since I have discussed this association, first thing, the main thing, Acanthosis nigricans is not a skin disease alone. It's almost like it's a sign, okay, it's an indicator that there might be something wrong in your body. Okay, so always whenever you are Acanthosis nigricans, okay, or you suspect Acanthosis nigricans, better visit a dermatologist or endocrinologist near you and do a proper workup, okay, such as investigations such as blood sugar levels, your cholesterol levels needs to be checked, your thyroid levels needs to be checked. Okay, and also if there is acanthosis nigricans along with irregular menstrual cycle, then a proper workup of polycystic ovarian disease, that all the sex hormones also needs to be checked. So it's just not a skin disease, it's a sign, it's an indicator, okay, of there is some problem. Okay, so it has to be all this investigation which I mentioned, better to do it. Okay, now let's understand what things to avoid. Okay, first and foremost, many people think that, okay, it is just a dirt in the neck, okay, just scrubbing will remove it. Okay, so I have seen lot of patients who have come to me, okay, who keep on scrubbing is thinking that it is a dirt and with scrubbing it will go off, and because of this scrubbing with loofers and other products, okay, there is a development of redness, there is development of irritation, sometimes acanthosis nigricans because of all these irritations becomes much more thicker. So don't do it. Just scrubbing, just physical scrubbing with loofers and all is not going to remove it. Okay, second thing is applying this besan, applying this baking soda. Okay, no, the application of besan and baking soda is not going to treat your acanthosis nigricans. It may irritate your skin, okay, and make your skin red and also increase your acanthosis nigricans. Please don't do it. Okay, so and finally, okay, you should avoid high carbohydrate, high calorie food and food which are rich in fats. Okay, why? If you're having high carbohydrate diet, okay, high calorie rich diet, the insulin requirement increases. Since there is an insulin resistance, okay, so since there is already increased insulin production, this leads to more insulin production, and this will surely worsen your acanthosis nigricans. So high carb diet, high calorie rich food diet, okay, and food which contains lot of fats should be avoided. Okay, so now let's discuss about the treatment. Okay, now let's discuss about the treatment. Okay, now first and foremost, okay, as I mentioned, it's just not a skin disease. Okay, it is, okay, if you have acanthosis nigricans, it's not just, it's an indicator. So particularly the main thing is lifestyle changes. Okay, that is, start reducing your fat. Okay, start reducing your obesity. Okay, to reduce your obesity, please reduce the intake of high carbohydrate, high calorie food, food containing high fats. Okay, increase your protein intake. Okay, because as I already mentioned, okay, these increases your insulin, this increases your acanthosis nigricans. Since also it's an indicator, okay, if you cut down your carbs, you cut down your calories, in the future what are the your chances of developing the other association, that is diabetes mellitus, okay, and metabolic syndrome. If you make these lifestyle changes, particularly if you reduce your carb intake, okay, then and also exercise. Okay, so daily start exercise for 30 to 45 minutes. Maybe it can be a jogging, okay, it can be a brisk walk. I'm not saying go to gym, get lot of weights, no. Okay, just make yourself fitter. Okay, just do activity. Okay, just walking, jogging and all. So at least for half an hour to 45 minutes, even 1 hour. Okay, so the lifestyle changes of reduction of high carb food, high calorie rich food and also regular exercises will help you. Okay, one is preventing acanthosis nigricans, and also since it's an indicator of there is some problem inside, it will also help you to prevent development of diabetes mellitus, okay, या metabolic syndromes in future, मतलब the cardiovascular problems, okay, because metabolic syndromes leads to high risk of cardiovascular diseases. So the chance of cardiovascular diseases, okay, reduces. So start with that, okay. There are exfoliating creams available. I am not going to mention any one of these creams because these are prescription medication. I have seen lot of videos where there are YouTubers, there are influencers, we talk about these exfoliating creams. Please don't self-medicate, okay, because these may irritate your skin, okay. It's like if it is not used properly, it may cause lot of irritation, maceration. So how long, what is the duration to be used, how to use it, these all things has to be done under the guidance of the dermatologist. Please don't do it by yourself, just seeing some influencers talking about it. Always consult a dermatologist, proper take a opinion from him, how to use the creams and all, proper under his guidance, you can do it. Also there is some in clinic procedure, okay, there is also some in clinic procedures such as chemical peeling which you can do, okay, to reduce your Acanthosis Nigricans. Even lasers, okay, can be done, okay, alexandrite laser can be used, okay, to reduce the Acanthosis Nigricans. But instead of doing all this procedure, first you should always think it's not as a skin disease, more than it has an indicator, okay, that you have some problem, okay, some internal, there are higher chances of developing some internal problem you already have or in future you will develop it. So always consider it's not as a skin disease. Its body is telling you, that is signaling you that it's time to do the lifestyle changes. Okay, reduction of carbs, doing the exercise, reduction of high fat diet. Okay, so it's a sign to do it. Okay. So I think I spoken in completely in detail about it. Okay. Thank you. Okay. For such useful information, please like, share and subscribe. You liking the videos obviously motivates me to make more such videos, more informative videos. Okay. Thank you. Wait for the next such informative videos. Thank you.